So now we're going to talk about urinary tract infections and lower versus upper urinary tract infections. So urinary tract infection occurs usually when bacteria ascend through the urethra into the bladder. And upper respiratory tract infections is when E. coli makes its way up to the ureters into the kidney pelvis. So with UTIs, lower UTIs, we're talking about cystitis, which is a bladder infection, or uveitis, which is urethra infection. It can also mean prostatitis. And when we talk about upper UTIs, we're talking about kidney infection. So pyelonephritis is the term for that. And there's a subtle difference between them that I will point out soon. Risk factors for UTI include women with shorter urethras and because the urethra is proximal to the rectum. Women with low estrogen levels or postmenopausal women are also at risk. People that wear synthetic underwear are at risk. People with bowel incontinence, diabetes, anybody with an indwelling catheter, and people with neurogenic bladder are also at risk for UTIs. And oftentimes they can be at risk for upper UTIs as well. And older adults are at risk for UTIs as well. The symptoms of a UTI can be remembered with the mnemonic FUNWISE, which is not really fun. Okay, so frequency. When people have UTIs, they have increased frequency and urgency. They may have nocturia or nasty smelling urine. They may have a weak stream. Intermittency. Itchy perineal area is another symptom they may have. They may strain, and some STIs can cause the same signs and symptoms, just FYI. And then emptying incompletely, so voiding in small amounts is also a symptom of a UTI. Older adults are going to have atypical signs of a UTI, so keep that in mind. Oftentimes confusion is the first symptom. They may, and also with transient incontinence, that could also mean they have a UTI. They could have frequent falls. They could be drowsy. They could have a poor appetite. Remember that older adults oftentimes don't generate the same type of fever as a younger person. And if they become septic, you'll see tachycardia, tachypnea, fever, and hypotension. Those are the symptoms you're looking for an older adult with a UTI. Treatment of UTI is going to include patient teaching, which I'm going to talk about in the next slide, but antibiotic therapy with either penicillins or cephalosporins. And remember, they have cross sensitivity to the allergies. If they're allergic to one, they may be allergic to the other. So like anytime you're going to give medications, you're going to check allergies. Sulfa drugs may be given. And then if somebody obviously develops a rash, they would stop the medication until they can talk with a provider. Quinolones like ciprofloxacin, okay, they're going to make the patient photosensitive, so they're at risk for sunburn, so they need to know how to protect themselves in the sun. They need to take it with a full glass of water. The other major side effect of quinolones is Achilles tendon rupture, so they need to report ankle pain. With pyridine, this is going to turn the urine orange, and we expect that, so warn the patient about it. It's a urinary analgesic, so to evaluate effectiveness, the patient would say they no longer have urgency, frequency, or pain on urination. Here are the patient teaching topics. Obviously, finish all antibiotics. Don't just stop when you start to feel better. Empty the bladder every 3 to 4 hours. Don't hold it. Void before and after sex. That's why women usually at the ages of 20 to 30, they're the largest demographic getting upper UTIs. Encourage fluids, cranberry-based products, inhibit bacterial adhesion, so that's a good intervention. Cis baths or hot water bottles for comfort. Wipe from front to back. No bubble baths, no sitting in wet bathing suits for a long time. Don't wear underclothes that retain moisture, and don't wear pantyhose, um, underpants, and don't wash underclothing in strong detergents. Acute pyelonephritis means somebody has an infection of the kidney. Pyleo means the pyramids of the kidney, so in the renal pelvis. Okay, it's usually one-sided when it's acute. The E. coli ascends up the ureter or makes it all the way to the kidney pelvis. Usually it's women 20 to 30, so they need to be taught to avoid before and after sex. Now, what you do need to know that CVA tenderness, which stands for costal vertebral angle tenderness, that you would assess by percussing the flank area, distinguishes an upper UTI from a lower UTI. So in other words, somebody with acute pyelonephritis is going to have the same symptoms as a lower UTI, but also have costovertebral angle tenderness, which makes sense if you know where the kidneys are positioned in the body. Okay. Now there is also a chronic version of pyelonephritis, also a chronic version of glomerulonephritis, which we'll talk about next. Also, people with polycystic kidney disease, which I haven't talked about yet, also becomes chronic. All the chronic conditions end up with chronic kidney disease. So you don't need to memorize the signs and symptoms of chronic because it's going to be the same as AKI in the oligarch phase and chronic kidney disease. It's all those signs and symptoms I talked about in the A&P lecture for renal and urinary, and it's all the symptoms involved in a wet bed.